Namaskar, and a very warm welcome to all for joining us for today's orientation lecture. It is a pleasure to have Dr. Sheetal Yadav with us today. Madam is an assistant professor of hospital management at Delhi Pharmaceutical Sciences and Research University, Government of NCT, Delhi. We welcome you, ma'am. Today, it is an honor to have with us Sir Dr. Ishwari Basavaraddi, sir, Director, Moraji Desai, National Yoga Institute. Sir has been the consistent support and encouragement who stood by us as our pillar of strength, who has also been the driving force and has enabled us to organize over more than 100 orientation lectures. We thank you, sir, for your consistent support on being the backbone for our endeavors.
Thank you, Suman.
Bef- Before we begin with the session, as per the tradition of the institute, we will begin the session with prayers. Om Astoma Sadgamaya Tamsoma Jyotirgamaya Mrityurma Amritam Gamaya. Om Shanti Shanti Shanti. Now, I again welcome you, ma'am. We again welcome you, sir, and thank you so much for taking time out from your busy schedule to be a part of this orientation lecture. I would like to introduce the speaker of today, Dr. Sheetal Yadav, who is a healthcare professional with 13 years of progressive work experience in academics, hospital, and health sector. Currently, she is working in as assistant professor in the Delhi Pharmaceutical University, Government of NCT Delhi from from the last 3 years. Earlier, Madam has worked as assistant professor at Amity University, Gurugram for 7 years, and for 2 years, she has also worked in the medical administration at Medanta, the Medicity. She has also associated with Planning Commission of India, Niti Aayog, as a consultant while preparing for ninth five-year plan for health sector. Dr. Sheetal is a PhD in hospital administration and MBA in hospital and health management. Madam is also green belt in Six Sigma methodology from Indian Statistic Institute, New Delhi. Madam has co-authored 7 books and a book chapter in Elsevier and has published over 23 papers in international peer-reviewed journals of great repute. We thank you, ma'am, and we welcome you for the orientation lecture. We also have with us the director of the institute, Dr. Ishwari Basavaraddi sir, with us today, who will be who will be introducing the topic of today's orientation lecture. And it is a privilege and honor for us to have Dr. Ishwari Basavaraddi sir with us. Sir's unwavering dedication and passion towards yoga has been instrumental in being appointed as the head of the Institute of Yoga Certification Board, Ministry of Ayush, Government of India, a position that Sir has held since 2018. Sir's exceptional emphasis on research is apparent through his position as a project director of WHO Collaboration Center for Traditional Medicinal Science Yoga since more than a decade. With his expertise and experience, Sir has made invaluable contribution to the development and advancements in the field of yoga and naturopathy. Sir is one of the eminent yoga masters of India and instrumental in bringing common yoga protocol for International Day of Yoga, its booklets and videos. Sir has served as the master of ceremony during International So it's almost done. International Day of Yoga since its inception since 2020, and in his role, he provides guidance to more than 40,000 participants, including the Honorable Prime Minister of India during International Day of Yoga celebrations of yoga across the world. As Sir always keeps time in mind, so without further ado, we will begin with the session. So now I would like to request Sir, Dr. Ishwari Basaraddi, sir, to kindly introduce us about the topic of the day.
Yeah. Om Shanti Shanti Shanti. Today's esteemed speaker, Dr. Sheetal ji, my colleague in the institute, Dr. Suman, Komal, Dr. Tayu, faculty members, student friends, and yoga enthusiasts joining this famous Friday webinar from different social media platforms of the institute. My pranams to you all. At the outset, I am very impressed by the Dr. Sheetal's CV. Very, very impressive, and it's a privilege to invite her to our institute for much more um lectures and collaborations and use her expertise in the public health sector. That's the first impression. Second one is my always request. It is introduction of the guest. I am always there. One word is more than sufficient. Director Moraji Desai Institute. Everybody knows Basavaraddi. You can save the time. That's my request again to Suman always. She is very kind enough to spare so many kind words on me. Third important aspect is to inform to Dr. Sheetal. Friday webinar is for us. It's a long journey. We started in 20 October first time, and many eminent speakers share this platform. We publish that in a e-booklet. The second one is also ready, and once you look back, we are so proud that uh, many star worlds has come and use this platform, guided our faculty and students, and also yoga persons, not only the subject related to yoga, and majorly on public health, wellness, and also the society. That also we covered. So it's our privilege that you are joining with us, and on my own behalf, I once again thank you for accepting our invitation, and also hearty welcome to you all, Dr. Sheetal.
Thank you so much.
And today I would just like to say three important things. Yoga is a tradition. It's a ancient tradition, and but many people don't say that it ancient tradition is based on the subtle science. For me, yoga is a science. I utilize and practice whatever it is come under the domain of science for the public domain. So that's why, though it is a tradition, it is subtle science. And science, second aspect, you want to reach the science to the people, you need the technology. Technology is the meaning itself is to take to the people. Whatever science is there, so if you want to make them technology into appliances, therefore we are using many technologies. The apps are coming up, the social media platforms, internet facilities. Nowadays it is one to one. So in the 70s, though we are not able to took group classes one to one, then only 5 people, 10 people. Now there is a lakhs of people are doing yoga under this direction of one master with all the technologies, mics, TV screens, so many things we are using it. That means the world is changing, the technology is coming up, and the right technology is always good to propagate the traditional sciences like yoga. Then, third important aspect, when you use the Tele-Yoga or any kind of thing, because it is always the direct knowledge. What is the challenging thing for me as a teacher? When we teach directly, we can see the expression, we can see the moment, and directly we can have a one-to-one correspondence. But in tele yoga or any type of this type of teaching, that facility is missing. But however, because of this tele yoga or technology, earlier I am using only 100 people I am teaching. Now I'm reaching 1 lakh people. 100 to 1 lakh. Last time in our entire team during the 2 years pandemic, nearly 42 lakh people we have touched. with one or the other programs on yoga for COVID or yoga for well-being. That means if technology is not there, we are not able to reach to such a huge population and help them. Yes, those who are having facilities, they can come and contact one to one, but technology also necessary. But right use of technology, following the IPR and other all the standard guidelines of the IT, which will protect the interest of the teacher and the patients. So I do hope that Dr. Sheetal will definitely throw light on such things how Tele-Yoga is the essential, and also it is the future. Tele-Yoga is the future, and what are the um, advantages, what are the technologies, what are the bottlenecks, what are the steps to be taken to or remove that bottlenecks, and so that it should become a user friendly. Ultimately, we have to reach to the public, and if it is public friendly, and any system will survive for long time. With these few introductory remarks, again, uh, I'm so happy that Sheetal has joined, and Suman has taken recently the coordinatorship, and I wish her all the best. My best wishes both of you, and I do hope the lecture will be very landmark, and we are going to publish your script in our annual journals. Thank you. I welcome now Dr. Sheetal for our lecture on Tele-Yoga, current scenario and future prospects. Dr. Sheetal.
Thank you so much. So, first of all, I would like to thank Dr. Khushbu Jain, who invited me for this. And I would also like to thank for facilitating this entire session. And then, of course, the more importantly, Director Sir, Sir, thank you. You've actually, told the jinx of the whole lecture that I'm going to deliver right now. So thank you for engaging with us on this day. Your presence in this matters to, I'm sure, to all the students and participants in the whole session. And you've actually told me, the moral of the story you've already told to the audience. So I'm just going to highlight on all those aspects that you've just mentioned. So I just hope that the audience do have an idea about what I'm talking of, and what the future of tele yoga can be, and how they can contribute in its future. So, Dr. Subhan, can I just share the presentation now?
Yes, ma'am.
Okay,
Please.
thank you. Can it be seen?
It's visible, ma'am.
Okay, so we shall just start.
Yes.
Okay. In between, I would also like to mention this, that in between, if any of the student or any faculty has any question, any query, or they would like to know in detail about any of the things that I'm touching upon in the slides, they can definitely highlight it and interrupt me in between. I would like to have an interaction on the same topic while I'm playing the slides. So I'm okay. They can disturb me. They can bother me with the questions in between as well. So no problem in that. Okay.
Okay,
So,
ma'am.
the slide is, the whole session is going to be around, the tele yoga, the current situation and future prospects and all. But before we talk about tele yoga, I think many of the students might not be even aware of what tele yoga is or what telemedicine is. So, firstly, I would like to highlight and touch upon the telemedicine part, because tele yoga is just a part of the whole umbrella of telemedicine. So telemedicine can be, tele-yoga, tele-ayurveda, tele-homeopathy, tele-allopathy, tele-radiology, tele-cardiology. So any means of healthcare service that we are providing where distance is a critical factor, right? So firstly, we will talk about telemedicine, and then we shall talk about the tele-yoga, right? So as per the WHO, what telemedicine is, okay? So when we are delivering any sort of healthcare service, Now that healthcare service can be any of the areas. It can be a ECG test. It can be a blood sample being processed. It can be a patient seen by an allopathic doctor. It can be a yoga session. It can be an anything. So any healthcare service which is getting delivered over a distance. So distance is basically a critical factor over here. The person should not be sitting face to face with the healthcare provider. The person has to be sitting at a distance. So person can be sitting in a rural area or any remote area, or any tribal area, not near the healthcare provider at all. So when the services are being provided by the healthcare professionals and using the ICT technology, ICT again, everybody knows information communication technologies that we talk about. So when we are using the ICT technology and we are providing healthcare service by a healthcare provider to a patient who's sitting at a distance, and that can be used for any sort of diagnostics, any sort of treatment, any sort of preventive activity. It can be for any research, it can be for healthcare education, for any of these purposes. So that is called as telemedicine, and tele-yoga definitely is a part of telemedicine. So why are we talking about it? What is the need for telemedicine, or what is the need for tele-yoga? Why it is so important that we are organizing a session on it, or why are we, certainly from last 5 to 6 years, it has, we can see a surge in tele-yoga sessions or tele-consultations or telemedicine. So why it is so sad important? The reason being is the most important factor in our country is the huge inequality that we have in our healthcare resources or healthcare infrastructure distribution in the country. So the chunk of our population in India that resides in the rural areas, while the healthcare providers, they are all settled in the urban areas. Okay, so as what the data says, that 70% of the Indians, they are living in the villages, and 75% of the Indian doctors, they are based in the cities. So therefore, all these secondary and tertiary care facilities are located, 90% of them are located in the cities and in the towns. Okay, so how do we reach out to that rural and remote population? Okay. Similarly, if you say WHO says that there has to be a one doctor for 1,000 of the population, and in India, the data says that we have only one doctor for 1,800 of the population. Okay, another thing. So how do we reach out to those people then? So how are the services which are inaccessible to a certain section of our society? How do we make it accessible to them? So the solution, or the how we can bridge this gap is the telemedicine. Through it, we can reach out to that population which is otherwise not reachable, or otherwise for whom these healthcare services are not acceptable, not accessible. So this is how the telemedicine works. This is the most basic telemedicine model that exists for your understanding, right? So if you can see, the healthcare services in this model, they are being connected, let's say a sub-center, or not a sub-center, but definitely a PHC, a primary health center, or a community health center. They all do have ICT technology. They all do have computers, and those computers are connected to the computers at a district hospital, at a civil hospital, you can say it, right? So all these services, let's say somebody needs a cardiology consultation, somebody wants to get an ECG report to be analyzed, somebody would like to have given a sample at a PHC of urine sample or a blood sample, would like to have a report from a district level hospital. So in all these kind of services, all the PHCs and CHCs, they are connected to the district hospital. So the services are being provided at the district hospital to the patients who are coming to the PHCs and the CHCs. So this is the basic government model that I'm showing you right now. And then that district hospital also, for the super specialty consultations, let's say a district hospital might have a cardiologist, a district hospital might have a cardiothoracic surgeon, but they might not have a neonatal cardiothoracic surgeon. They might have basic transplant services, but they not might have the cardiac transplantation consultation services, for example. So for such complicated cases, for such complicated super specialized consultations, they also need to speak to the specialists or super specialists who are sitting at a teaching hospital. Okay, so district hospital is also connected to a specialty teaching hospital, okay, which is usually one or two in the entire state. So all the district hospitals are connected to those teaching hospitals. And how are all these connected with each other? So they are all connected with a satellite network. So ISRO is providing that satellite network, but through the satellite that you can see just below the word telemedicine concept, through the satellite, all of these are connected to each other. Okay, even we also have telemedicine vans. Those are also connected via the satellite services to the teleconsultation or telemedicine centers. Okay, this is the basic model that you can see here. So teleconsultation or a telemedicine or tele-yoga, it can be done in two manners. One is synchronous, one is asynchronous. Synchronous basically means that while you are giving a yoga session to somebody, you are giving a yoga training to your patient or your client. So when you are sitting face to face on a live video session with your client or with your patient, and you're instructing them how to do a particular asan, or how to do your pranayam practices and all, so that is a synchronous. That means you're sitting with the patient live over the ICT technology, right? Asynchronous means, let's say there is a patient of COPD, or otherwise let's say there's an asthma patient, for example, or let's say there is a post-operative cardiac patient, for example. So before you make your plan for the patient, right, which asanas are going to suit initially, which asanas to be followed up later on, and with pranayam of what strength is suitable for a particular situation. So you make out your plan first, right? So therefore that is going to be asynchronous, that the patient is going to share his reports or her reports to you first, and on the basis of those reports you see the entire case of the patient, and then you make out your plan for the patient, and then you execute it. So that is asynchronous. That right now you're not live with the patient, but you are definitely dealing with your client and you're making out a plan for the client, and then you're going to execute it. So it can be a real time and it can be a store and forward, which can be called as asynchronous teleconsultation or tele yoga session. So what is the tele yoga therapy now? So otherwise, what you do, a normal face-to-face yoga session in your own center. So it is an alternative to the same thing. So now this is just a virtual consultation or a virtual yoga session that we are going to have. So when you're teaching the yoga asanas or the breathing exercises, the breathing practices, pranayam, relaxation, techniques and all that, but you're using the cloud technology, the ICT technology in doing so. So there is a trainer who's sitting over here, and there can be multiple people who are learning it or who are getting trained, or who are practicing looking at the trainer. So there can be multiple centers, or there can be multiple people sitting at their homes, and they just have logged into some app or some web-based portal, and through that portal, through that cloud computing technique, they're all connected to the particular trainer, and virtually they are learning how to do those exercises or those asanas or pranayams. Okay, so how do we implement tele yoga therapy? So some things are like, I think so that it is easy to train the people towards it, like how to do dhyan, how to do meditate. Multiple people can connect to you, and one person, one trainer can connect to all of them, and he can train them how to do dhyan, how to do meditate, and different dharans, and then different asanas, and the pranayams and all. But then at the same time, sometimes certain asanas, certain pranayam activities, or strong, I don't know, pranayams in certain cases where the patient is very critical, and if the patient doesn't breathe properly, may complicate the patient's situation. Now in those cases, it becomes very challenging that over the tele space, how do you teach your patient, or how do you train your client, okay, how to do it correctly? So there are two ways to do it. One way is that the people who are actually giving care to the patient directly, so you first train them, so they can come to you physically, and face to face you train the caregiver of the patient yourself, and then the caregiver can go to the patient and train the patient under your supervision virtually. So you are definitely watching over to the the caregiver, that how the caregiver is training the patient, or how is he making the patient practice, but you are supervising it, you are not directly doing it. Another way of doing it is that initially you can start the face to face practices with the patient. Okay, so you have to physically, you are there around the patient and training the patient. So once initially one or two sessions are face to face, and then you can move to the virtual mode. Then you can move to the over the ICT platform, and we can continue and monitor the patient in the longer run. So that is another way of overcoming this particular challenge in certain cases where it can be risky for the patient. Okay. So the telemedicine whole structure in India, how it is getting supported, or just a brief on that. So the Department of IT is the one who is managing this whole telemedicine network and satellite thing. So ISRO is the organization. Through its VSAT connectivity, that particular satellite is called INSAT satellite. So through that, all these, the whole national knowledge network is connected, under which all the teaching hospitals are connected to each other. Okay, all the teaching hospitals, including SGPGI Lucknow, or PGI Chandigarh, or AIMS, or all of these. Okay, and also the corporate hospitals are also connected to this, not just the government ones. So Sir Gangaram Hospital, Apollo Hospitals, or Dr. Balabhai Nanavati Hospital, Mumbai, Medanta Medicity Hospital, Gurgaon, the Narayan Hrudalaya, Bangalore, Shankar Netralaya, Asian Heart Foundation, and there are many, many, many more who are also, using the INSAT technology, and they're doing it. This is also ISRO's telemedicine network, a little older one. They have opened the portal on the NRHM website, and this is how it looks like. One, like maybe I think 4 5 years older than this. So let's say, for example, Udhampur, for example. So these are the ones who are providing the telemedicine services, and in the outer circle you can see the organizations which are receiving, or their PHCs or primary health centers are receivers of the telemedicine services. Okay, this is how a telemedicine center looks like. So these photographs have been clicked by me only while I was doing some research on the telemedicine centers. So this is how it looks like. And if you see at the bottom, there all bottom three are the photographs of the mobile vans which are having the telemedicine connectivity. So these vans are going to different villages, and people who are looking for healthcare services, for whom the healthcare services are not accept nor neither accessible nor affordable. They can't really travel that far to the to the proper hospitals for the treatment. So these vans are going to those places, and then people are coming inside the van. And if you can see at the bottom right, this is how the whole inside structure of telemedicine looks like in the vans. So through this whole infrastructure of this facility, they are connected to the doctors sitting at the teaching hospital. And there is a live consultation, and if there is some medicines which are prescribed during the consultation by the doctor, those medicines and everything are provided to the patients right over there, because everything is stored in the van itself. It's a huge van, you can see it. Okay, this is again how it looks like in the private hospitals, the telemedicine centers. This is a live consultation going on right now. This is a photograph that I clicked during a live consultation happening in a good corporate, big private hospital at Mumbai. Okay. Another one, again, a live consultation. So they have opened the portal on the NRHM website, and these people who you can see on the doctor's screen, they are getting connected from the PHC of Maharashtra to this particular corporate hospital. Okay. So what are the strengths of telemedicine services in India especially? So first thing is, for the remote patients, the services become accessible. It saves their traveling time to and fro to the district hospital. It saves patients money on transportation. The services of telemedicine are reliable enough. You can rely on those services. It prevents from worsening of patient's condition. Now, what happens is, usually it does that, patient is like, I'll go tomorrow, हम कल जाएंगे, या हम 3 दिन बाद चले जाएंगे, क्या जल्दी है अभी जाने की. So more they delay, more their condition gets worsened, and it gets more complicated. So through the telemedicine, it is very easy for them, to access the healthcare services, hence not delaying it, and therefore not worsening their healthcare situation. It provides desirable results. People are, ready. They are very much ready and willing to, opt for these services. There is no hesitancy anymore now, after the pandemic, especially. It also reduces the patient traffic in the district hospitals or tertiary care hospitals, and it is very much feasible and convenient to provide even by the service care providers. Now, looking at the opportunities that the Indian market has for, telemedicine. So our ICT is improving. The ICT infrastructure in our country is being improved. Okay, we are talking about national digital mission now. This whole surge that we see in the teleconsultations or tele-yoga sessions or tele-consultations, this whole surge that we see in the teleconsulations or other consultations, this whole surge has been seen after the pandemic, right? So right now there are not many competitors in the field. So it is very opportune time for people or in the industries for investing in this market. And it was also very much feasible for the hospital, whichever hospital has the internet facility or whichever institute has an internet facility. They can all go for providing the teleconsultations. And there has been seen so far good compatibility between the IT professionals and the clinicians when it comes in terms of providing these services, the connectivity and all. Now, what are the barriers? So barriers is if we believe that the tele-yoga sessions or tele-consultations are going to replace the face-to-face consultations, we are wrong. When we see a patient in person and the kind of judgment that we make for a person's or a patient or for a client's plan of action कि patient को हम क्या treatment देने वाले हैं, what would be the best suitable for the patient का exact diagnosis क्या है. So the way we do it when the patient is sitting in front of us and versus when we do it when a patient is sitting across some area and we are only virtually in touch of the patient, it is very much different. They are not two same thing. So if we actually imagine that one can be replacing the other one, it is not possible. So face to face, the consultations or the face to face sessions are always going to be getting the priority. But for the people for whom these services are inaccessible, for whom these services are unaffordable, for whom these services are very much difficult to go, or the people who are basically quarantined, or the people who have a hesitancy to go out of the house, people who do not want to risk, people who do not want to people who are lazy, you can say, also people who don't have time, for instance. So for all those people, this is a very convenient way of availing the healthcare services. Okay. Similarly, for our for any institute to have this entire technology installed with the getting connection with the satellite and all that stuff, so that is of high cost. So instead of cloud computing technologies, we can always opt for web based technologies, which basically means is you can design your own app and people can just download the app and go for teleconsultations or tele yoga sessions. That is the easier way to do it. That is a less costly or economic way to do it. Then also there is no benchmarking so far. I mean, there are no perfect practices which have been existing. So in India, we have been talking about tele yoga sessions from like last 4, 5, 6 years, especially more after the pandemic. But otherwise, there are no such benchmarks that we have. So, okay, fine, this is the ideal way to do it. Nothing like that. So we still need to make those benchmark practices, to be established in the country that, okay, fine, this is how we should be doing it. So nothing like that exists so far, and therefore we need to do it. Similarly, there are no, there are people, certain section of the society who are still very resistant towards it. They still don't believe in, teleconsultations or these kind of sessions. They still believe in, we need to go for a face-to-face consultation or a face-to-face session. Okay. Then again, there is little, digital illiteracy that we have in certain remote sections of our country. There are also high power cuts in the rural areas sometimes. There is also, poor internet connections in certain sections of, our rural India. So these are certain barriers that we still need to, work upon. Our, the policy makers need to work upon in that direction. This is how we are globally doing it. So if you see here at a global platform, the countries in the yellow ones, so North American countries, and if you can see the Western European countries, so they have have saturated in this market. They have excelled in it already. Almost 80% of their users and the patients and the population is already using it. In the red are the colors where there's still long way to go because their ICT infrastructure is still very poor, especially in the African countries and South American countries. But if you see the colors were in green, they have the maximum potential in this sector. So because we have not reached the potential yet, but we have it and we need to explore it more. So So, as per many of the researchers, what they say is the dependency of the factors which are decide that how much the teleconsultations or this industry is going to excel in a country depends upon the digital literacy of of that country, the access and affordability of their ICT infrastructure. Right. So, in a country like India or other South Asian countries where we have aging population, where there is a high incidence of communicable diseases, where we have a huge shortage of manpower in the health sector, where the healthcare infrastructure is already poor, the cost of healthcare in private sector is very high, and limited access of people have towards it. So in such countries, we have the true potential for the medicine market or tele yoga market and all. So these have been the recent developments in the country. So in 2007, there was national task force that was established, and finally they were out with the National Rural Telemedicine Network. And yes, it does exist. Okay, not 100%, but yes, it does. So there is a level one. In level one, all the primary health centers and community health centers, they're all connected to the district hospital, which I showed you in the initial model. At level two, the district hospitals are connected to the teaching hospital. At level three, all these teaching hospitals are connected to each other through the national knowledge network. And the level M, which I've just told you about the mobile telemedicine units through the mobile vans, which I've just shown you. After that, the major milestone was in 2019, where the government launched the e-Sanjeevani app. It was an app, and anybody could download it and use it. Okay, and after the Ayushman Bharat scheme, this app was hugely and across the country it was downloaded and was being used tremendously. The usage increased during the pandemic times. And then the most important landmark which came in, that was the telemedicine practice guidelines, which came in 2020. So now it is absolutely legal for the healthcare providers, for the yoga practitioners to provide the consultations or to provide the training to their clients or to the patients. Okay, so Ministry of Health and Family Welfare came out with these guidelines along with the Niti Aayog. In fact, the IMC also kind of gave its statutory support towards it, and it is now absolutely legal to do it. And they have laid down the guidelines in terms of how the medical ethics going to be followed, how are we going to take care of the privacy, how are we going to take care of the confidentiality of the patient information, the drugs which can be prescribed over the teleconsultations, how are we going to make the payments, what are the documents that are going to be required, what kind of technological platforms can be used. So all of that is given in those guidelines to move ahead in this direction. Okay, so how did we improve during the COVID-19? So during the pandemic times, the major problem was that all the doctors or the healthcare providers of any stream, they were getting themselves exposed to the virus directly just because they were seeing the patients. We have lost, so many healthcare providers lost their lives, just while treating the patient. So they were inadvertently exposed to the virus while treating them, while treating the patients. And at the same time, therefore, so many digital platforms like Practo and Docon, so many are there. So they actually witnessed a surge in teleconsultations as much as 100% every week, right? And more than half of the 50%, there was doctors more and more were joining these platforms. So there is another report by Ernst and Young which came in 2020, which also projected that India's telemedicine market might reach $5.5 billion during next 5 years, which is like 2020 to 2025, just because of the pandemic times that we faced. Okay, in fact, our Niti Aayog report also mentioned that during the pandemic times, the primary focus of telemedicine was to screen the patients of COVID-19 who could be just treated at home. For they don't really have to come to the hospitals for it, so they could just screen through the teleconsultations that you can stay home, get quarantined, and get this treatment. You don't need to come to the hospital, for example. Okay. In fact, like according to the McKinsey report, the virtual healthcare business models have evolved and proliferated during the pandemic times. But these are the most consulted teleconsultations. So neurology, endocrinology, pediatrics, cardiology, internal medicine. Now the question is, where is tele-yoga? Where is the yoga practices? So that is not amongst the most consulted areas. but it can be, the patients who are quarantined, the patients who are isolated, the patients who even in today's time, the lifestyle that we live in, where we don't have much time to go out and take in-person yoga sessions at yoga centers. In such times, why is it not the most consulted specialty or most consulted area? It should be. The traditional practices that we have, those should be, utilizing this platform as much as these areas are. Okay. So how is tele yoga useful, or how it can be more useful? Okay. So telemedicine is not meant for just the modern sciences or allopathy, or just like that, but it is also meant for traditional practices. It is also meant for alternative system of medicine, ayush, that we say, including the yoga experts, right? So it has worked well during the pandemic times, and many, in many areas, in many societies, many of the yoga experts have practiced it during these times. So it has worked well to reach out to the patients and solving their queries. Studies have shown that the tele-delivery of traditional medicine is feasible, it is acceptable, and it has shown positive health outcomes in the patients. Okay. Results have also shown that home-based tele-yoga classes for conditions like low backache, even for stroke patients, heart patients, chronic obstructive pulmonary COPD patients, it has been found as to be cost effective, feasible, safe, appropriate, and acceptable. Okay. So studies have shown that with the minimum technology, okay, including, you just need a laptop, you need camera wala aapka laptop, you need the speakers in the laptop and a mic facility in that, and you can give the tele yoga sessions absolutely successfully. Nothing else is required to do so. So yoga has been practiced. There have been evidences, there has been research that it has been successfully implemented or being used for these situations. So number one is like in mental health situations. So a number of yoga practitioners and schools of yoga have started using tele-yoga platforms to reach out to their clients during the pandemic times. Tele-yoga therapy has been found to be effective in reducing depression, anxiety, and stress in the patients. For persons with mental health disorders, it can have a number of advantages, including reducing the social stigma of going out to a health center and attending a yoga session. So it also helps in reducing that out. Prevention of non-communicable diseases. So it can be a helpful tool in primary, secondary, and tertiary prevention of all these diseases, and also well-being of the patient. In chronic pain patients, so that is also a condition where we require sometimes more effective. More important is pharmacological interventions, but when it becomes individuals who have the chronic pain and shows the promise for their efficacy. Yoga classes have been delivered via video conferencing equipments with two-way viewing, allowing for personalized instructions for the patients. And then again, we all know quality of life, how yoga improves the quality of life. We all know that. But through the tele-yoga sessions, it has been proved by the research that yes, tele-yoga was also equally effective in improving the quality of life in the patients. So quality of life, which is one of the major indices to assess the well-being of a patient, especially in the home quarantined patients, where it is usually very difficult for them to be compromised. So in those situations, implemented and improvised. So role of yoga in tele-yoga sessions. What a young country. So most of our population is working. So we don't really get time for moving out and taking these services face to face. The yoga therapists or yoga trainers in that ability and affordability of the internet services that is increasing in our country by every passing year. The ICT technology, the reach of internet facilities in the remote areas is increasing by every passing year. And this growth again was fueled by the latest telemedicine guidelines which came out in 2020. So we need to now focus on upon development of more tele-yoga apps. There are not many. We have platforms of Practo, many of them, but still there are not many. Direction. Practice guidelines also, especially we have those for relevant for them. So as yoga therapists, we need to make certain guidelines, especially for the guidelines, certain assessments guidelines, certain evaluation guidelines, certain best practices in this area. Similarly, yoga therapists also may need some specific training on how to do it. So we might need to develop a short training program for the yoga therapists who would like to provide, tele-yoga sessions. Okay. Ethical considerations of, privacy or safety of participants. How do we maintain their, take their consent or confidentiality before the tele-yoga session? So all of that might be, laid down before. And most of the participants are also not familiar of using these tele platforms. So you might have a short short training program that how, or let's say a normal video in which step by step you explain it to the patient. This is how you log in, this is how you register, and this is how you can book your appointment, and this is how you're going to have the session, how to coordinate the whole session. So all those things can be can be drafted in a short video, and can be shared with the audiences, or can be shared with the your clientele, go for the yoga sessions and all. So hence the participants need to be familiarized with the whole tele yoga sessions before you go ahead, so that you have a better quality of yoga session that you're planning to have. Okay, so that you don't suffer. uh, these are all the references that I used for the data that I've shown you, the facts and figures that I shared with you. Thank you. And now I would like to be open for the questions. If anybody has any query, or they would like to raise or add on to something to the presentation, or would like to highlight something.
Yes, ma'am. We do have a few questions from our viewers.
Please.
Okay. So the first question, which we have received from one of our viewers, is uh, what are some tips for the beginners who want to try practicing yoga through teleconferencing or online platforms?
So you're asking the books or something?
No, ma'am. What the viewers can do while they are taking such services through telemedia. For instance, someone is taking yoga classes through teleconferencing or any other
Viewer,
online platform.
as a viewer, you were asking.
Right,
Right. So that's
right.
talking that we need to develop certain, you might have a short video, let's say a 2 minutes of video, just to make the your client or your client, or your program for a patient. We are not doing so. It is going to be a live session. See, we are not talking about here, let's say, on the TV, if you've seen it. TV may, I think on the television, we have been seeing, yoga sessions from more than 2 decades now. There's so many yoga acharyas who teach us different asanas and pranayama on TV. So there is no feedback mechanism. The acharya cannot see what their patient is doing, or what the convenient for your patient to download or use that particular app. But at the same time, always remember, patients do come for the service provider. If the trainer has the good skills, if the trainer has the capability of training their clients on the screen during the live sessions, it is absolutely that is their marketing skill. If they are good enough, automatically more and more people are going to join. So make a user friendly app. That's the first thing. Or there are many apps available, if in case, in that case, you're just one of them, right? So your on how using the app also, plus your skills of communicating with the people, how to make your client easily do the things via live sessions, is going to decide how many clients you're going to have, or how are you going to market yourself. So your skills are going to be your marketing plus or marketing point.
Okay, ma'am, the actual question was, see, there are times wherein we come across yoga practitioners who are trainers for some of their clients. However, there are times when they are not very much acquainted with yoga. Okay, but then there are other trainers who have the authentic knowledge with authentic sources. Okay, and then they lag behind. So how can that group come forward?
See, I'll tell you, like, for example, in normal medicine practices and allopathy, like there are so many apps available, only the registered practitioners can join those apps. That's number one.
Okay.
Similarly, like your is a National Institute of Yoga. So if you develop a particular app, for instance, okay, for all your practitioners, for all your trainers, right, for all your yoga acharyas, there is one particular app. And it is you, the institute, who decides upon who is going to be the trainer, who is going to be, the acharya, or who's going to be the yoga guru or the naturopathy guru, for example. So you are the one who is going to look into the documents of those acharyas or those trainers. So you're going to decide who is registered, who can be at this level. I believe so that in every, in every medicine area, Okay.
Oh,
Once you have trained the correct postures, the correct positions, then you can go home and the patient can practice there again under your supervision over a teleconsultation call.
okay.
That's
Right.
what